Ask the Messengers, the program that deals with substance abuse. Real people telling real stories. Where there is addiction, there is a chance for recovery. We're trying to help save lives on Ask the Messengers.
I think everyone walks around with something that you can't see.
We all go through it. I don't care who you are. I don't care who you are, man.
The best thing that I did was to come out and say, hey, look, I need some help.
Never be ashamed of wanting to be a better you, period.
Did you know that approximately 2.3 million Americans today are affected by bipolar disorder, which is also known as manic depressive illness? Today on Ask the Messengers, Dr. Osa, who is a board-certified psychiatrist at Team Wellness Center, talks about the psychological aspects of this illness. Plus, one of our show producers shares how manic depressive disorder affected his family. Ask the Messengers begins now.
I want to talk today about manic depressive disorder and how it has affected my family.
Well, good afternoon. My name is Dr. Osa Yoha. My patients know me better as Dr. Osa. I am an adult psychiatric physician at Team Wellness Center in Detroit, Michigan.
I am the youngest of three boys, and my oldest brother, Jackie, he had bipolar disorder, and he was diagnosed at about 17 years old.
Bipolar disorder, also known to many as manic depression, is a mood disorder that is characterized by episodes, discrete episodes, where an individual may become severely depressed with associated symptoms, or conversely become manic or hypomanic, where they're in a sort of elevated mood state, and they are more vulnerable to very serious and dangerous consequences during those times. But the mood disorder itself can be fluctuating in terms of these episodes, and an individual can have many triggers or things that can precipitate it. But that is the general gist of bipolar disorder.
I think that was the first time my family was made aware of any type of mental illness with him. I think I was about second grade at the time. He was probably a senior in high school, and his bedroom was in the basement. And so my mother went down there to ask him something, and she was knocking, and he was responding, but he was kind of incoherent. So my dad went down, and he couldn't get in the door. It was locked from the inside, so he eventually broke it down, and we found that my brother had tried to overdose with a bottle of pills. So they rushed him to the hospital. He stayed in the hospital for about a week, just for psychiatric therapy and whatnot, just to make sure he was okay before he came home. And I think that was like the last time we pretty much had to deal with it until maybe his late 20s or early 30s. The thing with my brother, he was an artist. He was really good with his hands. He could paint, he could draw, he could sculpt, and he was a very popular tattoo artist in the city of Detroit, known as Rage. And he had shops all over, and he mentored everybody. He did tattoos, he did body piercings, he did massages. So we started seeing warning signs before he would go into these depressive states. Like I said, manic depressive, you go from one extreme to the other.
We classify bipolar disorder really into two categories: as bipolar 1 disorder as well as bipolar 2 disorder. Bipolar 1 disorder tends to be characterized by an individual who has, a specific period of what we call mania, where during this time a person may have an elevated sense of self. They will do or engage in very risky behaviors. They at that time really don't have a need or desire for sleep. And again, this is not due to taking of any substance or things going on. They just are sort of innately in this state during this time period. For some individuals, when they're in a manic state, they may also experience psychotic symptoms where they may hear voices or see things or become very paranoid. So it's part of what can occur in a manic episode. In bipolar disorder, bipolar 1 in particular, one is also exposed or can experience depressive episodes. So when they are in a state of a depressive episode, they may be extremely apathetic, meaning that they are experiencing crying spells, lack of motivation, and their appetite and their sleep is also disturbed, meaning they may sleep too much or sleep too little. And during this time may experience very negative thoughts, and at its worst experience thoughts of wanting to harm themselves or sometimes perhaps others.
We would start to see warning signs when he would just start working nonstop, constantly. He would throw tattoo parties, work 48 hours straight, no sleep, then come home and try to do some work and then try to go back to the shop, to the point where his body would take sleep away from him. There were times where we would be standing and have a conversation and he would literally fall asleep standing up or fall asleep taking a drink because he didn't sleep. He would just work until he couldn't anymore. And that would last for a few months. And then it would move to the other side of depression where he just locked himself in the house and he wouldn't answer phone calls. He wouldn't take visitors. He wouldn't clean up. It was just like the complete opposite of what had been going on months before.
One of the reasons I started talking about being bipolar, I just felt that it was needed. I started acting not my normal self, minds racing, staying up all night, crying for no reason. I started getting treatment. Yes, there was a stigma, and that's when I decided to start talking about it. We're gonna keep trying to erase stigma. What's more important? Get help, get treatment, get better.
Stay tuned for more of Ask the Messengers.
Hi, my name is Artesia Washington, and I'd like to welcome you to Irvine Neuro Rehab, where we help you reach your goals of rehabilitation. So you ask, why choose Irvine? Now here at Irvine, we offer physical therapy, occupational therapy, speech and language pathology, counseling, aquatic therapy, and massage therapy. And we help build you back to your previous level of functioning. Give us a call, 248-415-2500, www.irvineneurorehab.com.
The world is opening up, and when it opens, you want to be ready. Concerts, clubs, weddings, dinner with friends, or just hanging out. Soon, Detroit will be back, and you know how we do it. For 3 decades, Fashion International has been here when you needed to look your best, and that time is coming again. Check us out now. We have the latest styles to have you ready for the new normal. Fashion International, 10 Mile and Greenfield.
Hi, my name is Brenda Owens. I work at Greenfield Hair Collections, and I love doing hair. I've been doing it for almost 30 years now, actually. And I do a little bit of everything. This style right here is a pin curl. This is my weekly client, Lenise, short and sassy. She just got a fresh haircut last week. The name of the salon is Greenfield Hair Collections. We're located on Greenfield between Outer Drive and Curtis. I'm on the 2nd level. My name is Brenda. My phone number is 313-729-8194. Give me a call. I love what I do.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available.
You can pay online by visiting the Wayne County Treasurer's Office website. Paying online is easy and convenient.
You can also download the mobile app and pay with your smartphone.
You can pay at one of 70 kiosks located throughout Wayne County.
And yes, you can always still send in your payments using the U.S. Postal Service.
If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or mask is required and social distancing is observed. Your health and safety is very important to us. You can also email our office at textinfo@waynecounty.com or call us at 313-224-5990.
If left untreated, depression can lead to mental disorders such as alcohol and substance abuse, higher rates of recurrent episodes, and higher rates of suicide.
There were times where people would go over to his house, and my mom even would go over, and he wouldn't let her in. A lot of times I was the only person he would let in the house. And I would go over there and I would take him food and I would talk to him. And just, make sure he was okay, make sure he wouldn't try to harm himself again. One time it got so bad, I had to go and have him committed just because I was just that worried about him. And my mom told me, don't tell him you did it because he's going to be mad at you. And so she took the brunt of that. All this time, he believed that she was the one that put him in the hospital. And he was angry with her for a minute, but it did pass. And he stayed in that facility for about 2 weeks. And I remember the day I went to pick him up. He was so excited to be out the hospital. And we went to the movies after. We went to see The Matrix Reloaded. And we hung out that whole day.
Well, as I mentioned to you, bipolar disorder, we do have bipolar 1 disorder, which can tend to be more, clinically, can be more devastating in terms of one's quality of life, whereas bipolar 2 disorder doesn't necessarily appear to have some of the consequences we see with bipolar 1. Having said that, we use multiple modalities to treat and to manage bipolar disorder. Namely medication. Medication tends to be an important aspect of care because it helps to stabilize the person in the mood state, ensuring that they're not having these, quote, highs and lows that they typically have without medication. We also utilize a variety of talk therapy modalities. So that could include anything from cognitive behavioral therapy, trauma-informed therapy, group therapy, all of these things that would allow an individual to increase their level of coping skills and better cultivate their ability to manage stressors that they may be having day to day. With bipolar disorder, we also like to utilize a lot of psychoeducation, meaning that it's very important for patients as well as their families to really understand, what is this disorder? How can my family members be there for me when they start to be concerned? What are my triggers, or how can I, notice or be aware of when I may be coming into a depressive episode, or when I may be feeling more, energized, and maybe I'm on the cusp of entering a manic episode. So the educational bit is very important in terms of treatment and management. But those are some of the 3 basic ways in which we manage bipolar disorder.
He would call me every Friday morning and tell me to go to Western Union, and he left like either $50 or $100 for me. And for a freshman in college, that really looked out. It came a long way. But it was just little stuff like that he did for people. He was a teacher, he was a mentor. Like I said, he took a lot of people under his wing and taught them how to tattoo and taught them how to do body piercings. There's a lot of people that I run into in the city today that I tell them that's my brother. They always show me their tattoo. They be like, oh, I work with your brother over this spot, or I worked with him at that spot. And it's good things to hear when people say good things about your brothers.
When it comes to mental health care, and we are coming into a time where folks are talking about mental health much more than we have in the past, but I think many folks have had bad experiences, whether that be, families have had to take their loved ones to the hospital when they didn't want to go to the hospital, and that in and of itself can be traumatizing. Individuals may have at one point been open to mental health care, and maybe they had a bad experience with medication or with a care provider. And so these things can be pretty deterrent. They can be huge deterrents for individuals. But again, we are seeing that individuals are having successes. Families are more involved in understanding what they can do to be there and support their family members when they are going through mental health crises. And patients themselves are also feeling more empowered and having a sense of agency in that they know what they can say no to, and and they can choose the type of provider that they're seeing and what they expect from their care team. And so all of these things I think are improving, but historically those are some of the things that have been deterrents for folks to seek care.
Like I said before, it was hard watching him go through this back and forth. Sometimes a year or two would go by when he wouldn't have any issues with his mental, and then all of a sudden we start seeing those signs again. And it was hard for the family, it was hard for my mom, it was hard for his friends, just to watch him go through that because he was such a lovable person. It was especially hard because my brother, I think he wanted to seek treatment, but it was hard for him. I know he didn't necessarily want to be on medication because medication is like a boutique drug. It's specific to every person, and they have to get the dosages correct, so that it helps you. And a lot of times it's hit or miss. It might make you feel worse before it makes you feel better, and he didn't want to go through that. And he didn't seek psychiatric or help from therapists because the times that he did, stay in mental hospitals or whatever, he said they treated him like he was nothing. He said that when he talked to staff at hospitals, they would be dismissive of him and kind of shoo him off. And when you're in a depressed state, people treat you like that, it doesn't make you feel any better.
Well, I won't say that, there have been some studies that may show that there is an increased prevalence in communities of color, but really the prevalence of bipolar disorder, sort of on a whole, generally speaking, can be quite low. However, of those who are affected, we see that in minority communities, the level of access to mental health care is lower. And so we see that many of the other factors, things that can contribute to poor outcomes, are worse for African Americans and those who are in Latino communities. So for example, having access to general basic health care. You can imagine that if someone already has a number of pre-existing physical health conditions, on top of that, they're also dealing with bipolar disorder. We do see that the exacerbations or the severity of their symptoms can be worse. Not only that, we can find that it's much harder to, provide care for those individuals because they have many more barriers to their care. And so it's not that you see it more frequently or it's more prevalent in the community, but definitely there are many different factors that contribute to how the success that we see in treating individuals of certain communities.
In January of 2007, January 7, 2007, my brother took his life by jumping off the Belle Isle Bridge. And it seems like leading up to that, I saw changes in his characteristics that were never there before. Like, he started smoking clove cigarettes, whereas all his life he never smoked. And then he started drinking, and it wasn't like he was turning into an alcoholic or drinking an excessive amount. It's just the fact that he was drinking. I had never seen my brother drink anything until later in his life. And it was mostly beer. It wasn't hard liquor, but it was still something that was uncharacteristic of him. Mom said towards the end he was starting to hear voices, but he never admitted that to me. But I did see him starting to act out of character, where he was just, seemed like any little thing bothered him. He would get annoyed quickly. He was really quick to snap. He was dating a young lady at the time who really didn't help the situation at all. At times, I think that she made it even worse. And I know I can't blame her for what he did, but still and yet, she didn't help. I know my parents wanted to help, but back in the early 80s, there weren't facilities available and there weren't the tools available like now to help a person get treated or deal with manic depressive disorder. It was almost unheard of back in that day.
We'll be right back with more of Ask the Messengers.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available. If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or mask is required and social distancing is observed. You can also email our office at taxinfo@waynecounty.com or call us at 313-224-5990.
If you or someone you know is battling with any type of cancer, you need to read the book by Laverne Moore Slaughter, God Encounters Are Real. In her book, she tells how through prayer and faith, God healed her and set her free from stomach cancer. For more information and to get your copy, visit www.encountersarereal.net.
God's World, a Detroit institution at West 7 Mile in Schaefer says, get them while they last. The Old Bombers 2017 commemorative calendar is going fast. Get your church supplies, communion cups, tied envelopes, Bibles, inspirational books by top authors. Call in your orders at 313-862-8220. Shop online at godsworldsuperstore.org. God's World, for all your inspirational needs.
Hi, my name is Artesia Washington, and I'd like to welcome you to Irvine Newer Rehab, where we help you reach your goals of rehabilitation. So you ask, why choose Irvine? Now here at Irvine, we offer physical therapy, occupational therapy, speech and language pathology, counseling, aquatic therapy, and massage therapy. And we help build you back to your previous level of functioning. Give us a call, 248-415-2500, www.irvineneurorehab.com.
The goal and what we want to make sure individuals understand is that mental health in general, but bipolar disorder specifically, is a disorder that high functioning individuals live and live with and do well with. People have jobs, families, children. They go on to lead very productive lives, and they have bipolar disorder. It does not have to be a disorder that condemns one's ability to live a healthy life. This is why engaging in mental health care is so critical. And this is why when one does engage in mental health care, it has to be productive. It has to be with a care team that understands all of the things that could prevent that person from continuing care, because we want to be sensitive to that. We want to put the patient at the center of their care so that they feel advocacy. They feel that they are in charge of how they move forward in their health care. But I will tell you that I have many patients, many of whom work and function in the community. You would not know that they have bipolar disorder other than the fact that they tell you that are doing very well. They take medication that works well for them. They engage in talk therapy, and they have all of the support that they need to function and live well.
If I could say something to someone to help them, I would just say, if your people are going through depression, which is a lot of people right now with this pandemic going on and being in quarantine, there's just so much going in the world where a lot of people are dealing with depression and dealing with anxiety. I myself deal with anxiety attacks. But I would just say keep an eye on your family. Look for warning signs. Look for that manic activity that they go through where they're just working or doing something nonstop, and then boom, they're secluding themselves and cutting themselves off from family, friends, and loved ones.
Well, so I would tell you that if you're in the Wayne County area, which is where I practice, Detroit Wayne Integrated Health Network tends to have a lot of resources for individuals in the county in terms of getting them, referred to the appropriate care team or facility. Nationally, we have the National Alliance on Mental Illness, NAMI, which provides a lot of resources for not just patients, but for families as well. But those are two places that I would tell folks to kind of just to start in terms of re-engaging or engaging in mental health care.
Talk to your people. I think that's something we've gotten away from with technology. We're so used to texting and sending instant messages that we don't talk to our people. You can't see how a person is feeling through a phone or through a screen or through a computer. Reach out to your loved ones. Talk to your loved ones. Take care of your loved ones.
You may not realize it, but these words, often used to describe someone with a mental health condition, can be very harmful. In a country where 1 in 5 people are affected by a mental health condition, it's time for all of us to step up and change the conversation. Just because someone's struggle isn't obvious on the outside doesn't mean they aren't hurting on the inside. We need to see the person, not the condition. Join with me, pledge to be stigma-free.
Well, that concludes this week's episode of the Ask the Messengers TV show. We hope something you heard today helped you in some way to understand addiction and to give anyone struggling the desire to surrender and seek help. If you or someone you know is experiencing anything that seems to be too hard to handle, please know there is a way out, and don't hesitate or be afraid to seek help. Until next time, may you seek a power greater than yourself so that you too can turn your mess into a message that will help save lives. Continue to stay safe, and most importantly, be kind and love one another.
Won't you help us to do exactly what our motto is, and that is to help save lives? Won't you send a generous donation to the information there on the screen? We would love to have you as part of our partnership to help save lives. You may not be able to go out in the street, you may not be able to come here to the show, but you can send your donation that helps us save lives.